I want to start with a brief introduction to this course and give you some general information that you might need to know. Now, over the last 20 plus years, I've worked with literally thousands of children and had hundreds and hundreds of conversations with parents who have had just a real struggle trying to get the information they need to figure out how best to help their child. There are just so many issues and challenges that arise for all children that I wanted to make sure that as one of these parents, you have the opportunity to learn as much as possible. I have no agenda. I'm not here for anyone except for you and your child, and I'm trying to put out information that is just objective, is pros and cons, information about what might be going on with your child and ways that you can help address that. Specifically, of course, my focus has to do with pediatric bracing and pediatric orthotics, and I intend to cover the whole gamut, everything from something very mild like a foot orthosis all the way up to full body bracing systems for children that are much more involved, and everywhere in between. And so I just want to give everyone some baseline information of what is out there, what the options are, what the pros and cons are, and how they can be used for children that may be similar to your child. Now, just as a disclaimer, I do not know you and I do not know your child, and so I am not and cannot give medical advice for your situation. What I do want to do, though, is give that baseline information, sort of a foundational understanding that you can take and talk with your medical team about. So what I would love for all of you to do is to download this link for this course right to your cell phone, and the next time you go to therapy or go to a doctor, if there's something that you think might pertain to your child, you can pull it right up and show it to them. You can take a screenshot, whatever is going to be helpful for you. This course is intended to serve as a foundation of information regarding bracing options and therapies and conditions that we can treat with bracing. And so I'm not giving specific advice for your specific child, but I just want to get the information out and give you the information that you need so you can ask better questions and get better answers and then move forward with that. This course will be somewhat of a work in progress. I am starting with my 20 years of experience and trying to give all of the information that I think will apply to the families that we hope to serve here. And there's no way to cover everything that could be relevant to your situation and to your family. So what I would also invite you to do is feel free to email us at pediatricrehablab@gmail.com. And if you have a specific question or a specific topic that you would love to hear more information about, send that to our team and we will work on getting that in. My hope and plan is that this program will evolve and grow as time goes on. As I have patients of my own that are willing and able and good examples for this educational program, I hope to be able to include some case studies in with this program, and this should be a good resource to help you figure out what to do when things do change. And part of the reason that I'm wanting to do this is because we are all dealing with the effects of COVID-19 and the fact that you may not have the same access to your doctors or your therapists, or you may have a child that is immune compromised and do not want to go out into public any more than absolutely necessary, and that's so understandable. The challenge, though, is that your child has needs and perhaps therapy needs or bracing needs, and it is difficult to make sure those needs are being met. So this program, in addition to providing just general information, is specifically something that I wanted to get done as quickly as possible so that we can help families who are not able to go to the doctors and not able to spend as much time with their therapist face to face and are still struggling with these sorts of challenges, which we'll talk about in this program. And if you do go see an orthotist or wonder if you need to see your orthotist, you need to know what questions to ask, what things to talk about, what to tell them is occurring at your home. And this program is going to help give you that baseline information. So when you do talk to either the doctor or the orthotist or the therapist, you can develop a much better plan as to how to proceed. When I see patients in my office, for the first time, or maybe if I haven't seen them in a year, it's sometimes a little challenging to know where exactly they are with their development, what exactly the physical challenges are. I mean, I have children that are at this point scared to go out into public or scared to go into doctor's offices because they've been at home so much. And so sometimes they're not willing or interested in performing or walking or cooperating with even, checking range of motion and things like that. It can be very traumatic for children. So getting this information ahead of time, helping you to understand what to bring along and what the questions are going to be when you do come into the office, helps us all sort of narrow down the best treatment plan and to make sure that we're on the right track as far as what the biggest challenges are, what sort of things we hope that your child can do through therapy, and what sort of things we hope your child can overcome on their own, versus what types of specific challenges do we need to help address in order to help your child safely and effectively make progress through their next developmental phase. As a pediatric orthotist, we have 3 primary goals that we are hoping to achieve with every pediatric patient. And I want to make sure you have the information you need to make sure that your team is on track with these goals as well. Number 1 is prevention of deformity. Children, especially younger children, are very malleable and adaptable, and their bone structure, their skeletal alignment is not yet determined, and it can sometimes go in a more positive direction or a more negative direction depending on what is happening with their body and their development. So our goal is to work as part of the medical team along with the doctor and along with your pediatric physical therapist to help make sure that we are providing the right stretching, the right positioning and correction of alignment in order to prevent permanent deformity from occurring as they grow. Number 2 is improvement of function. So in the vast majority of children that we treat, your child should be functioning better with their brace on or with their orthosis than without. If function is not improving with the orthosis that has been provided to you, then there's a really good chance that something is not right. And so that's the second issue that we need to talk about. The third issue, the third goal that we have with all pediatric patients is making sure that we are helping to facilitate proper development. And what that means is we need to make sure that we are not over-bracing or under-bracing for that specific child for the next 6 to 12 months. Our goals should always be to provide the least amount of orthotic support that is necessary to help them with their development. This is very often a judgment call. This is done by trial and error, and this is done over time, and it changes over time. So evaluating the type of bracing that is necessary and evaluating what your child is capable of or what they need the support of the brace to help them with can definitely change year by year, sometimes month by month. So it's very important that we understand what the long-term goals are for your child and how the bracing itself can act as a therapy tool along with your therapy and along with the work that you're doing at home to help your child develop on their own to their best capability. On the flip side of that is making sure that we are not under bracing or missing the opportunity to give them some support that they truly need at this point in their life, which then would cause them to struggle and to have more challenges or pain or poor endurance or whatever the issue may be. And so it's really finding that fine line of giving the exact amount of support that is necessary for now and allowing them to continue to build strength and work on everything else that they can do on their own, with the long-term goal of hopefully having them improve as they grow and develop and get stronger.